Well, hello and welcome to Hiring for Good podcast. I am Tanis Morris with Acumen Executive Search. And as usual, I have with me my lovely co-host, Suzanne Hannafin.
Good morning, Tanis.
Good morning. We are honored to have with us today Ndeye Makalou, a global health leader with vast experience in the pharmaceutical and healthcare industries. Ndeye began her career in her home country of Senegal, where she earned her doctorate of pharmacy degree. She moved to the United States to pursue further academic achievements, and what was meant to be a 2-year course of study turned into over 20 years of clinical research, R&D drug development, global supply chain solution management, and executive-level strategic initiatives that drove growth and innovation across global markets. Ndeye has spearheaded initiatives that expanded access to vital medicines in sub-Saharan Africa, turning boardroom strategies into access to life-saving medicines for countless individuals. She believes leadership is foundational to positive change, and her endeavors are rooted in her passion for global health equity. After years of corporate leadership, Ndeye has founded Global Impact Bioconsulting, where she supports corporations and nonprofits alike in finding solutions that drive sustainable growth and create meaningful impact on global health. Ndeye is a board member, community volunteer, and recent transplant to Oregon, where she's meeting with us today. Ndeye, welcome to Hiring for Good.
Thank you so much. Good morning. I'm really super excited to be here and really very honored to be, with you both.
Oh, well, we're so excited to have this. Yes, I know just a little bit about your fascinating and incredible journey. But we always start by asking our guests to kind of tell us their story. And I know you have a really interesting, diverse, and pretty exciting story. So feel free to tell us everything or parts that you want to focus on, but just kind of help us understand how you went from your early stages as a pharma student to where you are now.
Thank you so much, Tanis. My career has been a purposeful journey to really understand medicine and how it is made for patient, right? And also addressing global health. Mm-hmm. So I studied, after my pharmacy school, I studied doing research in sexually transmitted diseases at the teaching hospital in Senegal. Mm-hmm. And then I wanted to know more. I wanted to really understand, because I was working a lot on microbiology lab. And I wanted to come to the US and learn more get my degree in microbiology. Mm-hmm. And so that I can continue to support patients, especially women in my home country, to support them and help them with diseases that they were having. So I came to the US and ended up in Houston, Texas, and went to Texas Southern University. That's when I got my microbiology, my master in microbiology. And I started working at Baylor College of Medicine as a research analyst and working in HIV this time. Then I went to MD Anderson Cancer Center, still in Houston, doing research, and this time I was on lung cancer. And this is really where I get to see patients, with cancer, and that's where my drive is and my passion. Those were really very formative years about science and how science can actually help patients and transform people's lives. Then I wanted to get into the industry and how do I use my my degree, and wanted to learn this time the life cycle of medications. That's really what I wanted to do. And that's how I found Genentech. I moved to San Francisco and studied in the lab also, but this time being in quality control. And I've always been driven by curiosity. My initial question was how do we make medicine for patients? That was the question I wanted to answer. So I was in the lab doing also quality control of final product before it gets to market. It has to go through us and working with QA before we say, okay, it can be released now for patient. After doing that for a few years, I was curious about, now how do we get to these final vials that I test all the time? And I found clinical trial management, learn a lot about clinical studies, and start doing cross-functional team leadership. Then the next question in my mind, how do we make it now? How do we get to this protocol that I'm executing? And that's where I found myself into the research and development part of the organization in the portfolio management. And this time really leading cross-functional team, and everybody who's involved into developing medicine was there. And I did it for different therapeutic areas, and it was just like quite fascinating. And so the next question then is like, how do we take it to the market and how do we take it to the patient? That was a question that I had. And at the same time, I was asking questions about what's happening, what's the company doing in Africa. And I got my answer. Like they were actually doing some access strategy in the continent to enable access to breast cancer medicine in sub-Saharan Africa. And they needed help. So I just raised my hand.
That's amazing.
What
a journey.
I just raised my hand and went, took my entire family with me, and started working with our colleagues in the continent and, trying to figure out what's the barriers to access for the people. And along the patient journey, addressing and working with other organizations, the HCPs, the Minister of Health, the WHO sometime, or the World Bank to address financial issues, and the patient, patient organization, community leaders coming together, looking at what are the different gaps in the patient journey, and what can we do together, because we didn't have all the solution. So everybody needed to play a role. This is why I strongly believe in public and private partnership. So I'm always driven by curiosity. I always want to challenge the status quo, and and stepping outside of my comfort zone. And did that for 4 years. I did 2 years in the western part of the continent, then 2 years in the eastern part of the continent. Now this time as a commercial head for Roche in East Africa, in charge of sales, marketing, and business development, and leading expert to do that. We came back in early 2019 before the COVID, and then that's how I got into global supply chain and translating commercial strategy into global supply strategy and understanding really the manufacturing, which is another part of a pharma business, very, very important. And it was amazing, working together, bringing people together, different functions, and solving big problem. It's something that I really enjoy doing, and it's been an amazing journey. And so far, it's been fantastic, and I'm so proud and, really honored to continue doing that work and addressing global health, especially for patients in underserved communities.
This is amazing. I tell you, the journey, I love what you said, that you just kept asking questions and not being satisfied just because the way we've done something in the past is the right way to go forward.
That's right.
But as you go through your career, I think we've all, as leaders, take a step back sometimes and go, what have been the formative learnings? Whether it was a mentor, whether it was something that really has changed your approach to leadership. I mean, you're bringing drugs to a country, managing from idea through production, but share with us some of those formative ideas.
My experience, leading such a complex initiative in many different countries in the African continent, this is really had shaped who I am now as a leader. I learned a lot about myself as an individual, but also learn a lot about leadership during that time. You can imagine you're leaving your comfort zone, living in San Francisco, and just going out there. You are managing a huge change in a space that you're not familiar with. It's just like me coming to to Portland, not knowing anything, trying to navigate my way.
Not exactly
the same. Yeah, this one is piece of cake compared to the one that we had. But, it's like you're coming in and you're managing change, not only in your family, but also managing change in a continent, different countries as well, because the African continent is it's like 54 countries. But I had 6 countries in scope, and going to different, cultures are similar, things are different. So what you learn is like, what made you successful before, where you came from, is not what's going to make you successful where you are. So I needed to unlearn certain things and relearn in order to be successful. It's basically taking a step back, slowing down in order to go faster, because the way I was working at Genentech at that time wasn't going to be the same in in that part of the world. So that's definitely one thing that I had to learn as well. But also, when you are put in a situation where you have like limited resources, you have to learn to be very entrepreneurial, right? And solving problem, not taking no for an answer, but also like when you are also with people with different cultures than you have, both from a personal perspective, but also from a career perspective, humility is something that one need to have in order to be successful. And for me, there's the formative experience is like when I was in my commercial role in East Africa, and being put in a situation where I have like a team of experts. They know the culture, they know the company, they know the country. I don't know anything, but I have that strategic level experience and I'm leading them. So it's all about being humble enough and servant leadership. And I remember one of my great mentors who had a big influence on in my career said, love them. And I could not understand, what do you mean, love them? So you need to lead with love. And leading with love is something like a concept that I had a hard time. But as I was going through that journey, building relationship, building trust, listening, paying attention to, and taking care of people, right? So that servant leadership, helping them understand and putting yourself in their shoes, because then to better understand what challenges they're facing so that you are able to remove those barriers. I had to learn what my role was in that context, right? So it's that leadership, servant leadership is something that I really like always as my approach, but also understanding people, asking the right question, and removing barriers, empowering them. And it's amazing what people do when you actually do take care of them. You take care of them, they take care of the business, they take care of you.
Wow.
That's definitely something that I have learned, and that has shaped who I am as a leader today.
That's beautiful.
Well, and it's interesting, leading from love, that in itself can mean a lot of things, because again, as a mom, it's taking that of sometimes you're hard, sometimes you're forgiving, sometimes, it's all very situational.
It is very situational, and sometimes, yes, you have to be tough. But then you can be tough by being loving. You can be tough because you need to, teach someone something, or because you want them to, you see the potential in an individual. Then that tough love is important so that the person can see what you're trying to do for them and then make the change that you need them to make, and not giving up, right? So that's definitely one of the things that I have experienced as a leader, and seeing that happening before my eyes and never giving up.
Wow. And before we ask another question, if this is okay, you talked about a partnership also between government and private, and which I think is interesting as a business leader, because you want what you're doing, is going to help, is going to be beneficial to the end user. So talk to us about this partnership too. And were you sitting at the table? How did that come about?
Yeah, like sometime I was sitting at the table, sometime I wasn't, depending on what's happening, because I was working with my general manager at that time. But then the way it happens is like we all have like this, looking at what's our strategy, what's our goal, and see where do we have like the same objectives, and how do we support each other in achieving our objective. Like I said earlier, when we look at the patient journey, there are some gaps. We have a medicine towards the end of the journey. When it's come to treatment, we have the diagnostic at the beginning. Yeah. But in this case, it was all about breast cancer. But then, in between, you will see that, patient may need chemotherapy, patient may need radiation therapy, and we did not have those capabilities. Others also wanted to bring solution into the continent. So why don't we come together? I believe that when people collaborate, amazing thing to happen.
Yeah.
is
We
amazing.
really like have innovative ideas, and that's how it happened. Just like, okay, what do we do together? And enabling, and even when it comes to building capabilities, for example, seeing our relationship, within the company, but also even outside, how might we help, like building some capabilities so that those folks that are part of a breast cancer management, managing cancer, also have the capability to be able to help the patient. So it's like just like providing, those solution and partnering, because we couldn't do it all. But that holistic approach is what was made us successful.
Well, and I love that holistic approach is also kind of rooted in that same heart-centered approach to leadership and collaboration. So I'm assuming that love might be one of your kind of core values. If you were to identify other values that are defining characteristics of who you are, how have you been able to operationalize those individual values and kind of transfer them to the organizations or the people that you're leading?
Yeah, that's an interesting question. For me, the other value that my parents always have given me is, integrity, having empathy, always be honest with people and be kind to people and have the courage as well. So those ones, I always bring it into wherever I go and leading people, whether I'm leading them directly or indirectly. It's something that I carry with me all the time in my career. Always being honest, and that's how you build trust, and that's how you build relationships. So I love building relationship with individuals, getting to understand what's important to them, and getting to know each other, learning what do we need to do, how can I help you, how can you help me, and as long as we have the same understanding of what the objective, and also listening is so important. Sometimes leaders need to listen, and listen to understand, not listen to respond. Right.
Can I follow up a little bit? Two of the values you mentioned are honesty and courage. Have you had to call upon those to call out inequity? I mean, so much of your job was rooted in finding equitable solutions for people that just didn't have access. Have you had to call upon those values and like demonstrate them, like to call out inequities that were hard to, have you had to speak up in a way that was uncomfortable for you ever?
Oh, yes, I did. I remember 6 months into the continent, actually 3 months into the continent, what I have seen was a misalignment between what the objectives were of what we wanted to do in Africa versus what individuals were incentivized to do. So there was a misalignment, and that created a lot of conflict. And change, it was a huge change, okay? Completely different from the way business was conducted. We are bringing new innovation into those countries, and that's difficult because people need to learn the medicine, how do we market it, all of those things. But there's misalignment, and those misalignment create conflicts. And in any change, there may be conflicts. And it was challenging for me because at some point, all I was doing is managing conflict. And that's not the reason why I came. So I had to have a conversation with my manager back then. Like, this is not working. And mind you, I have my family that I'm managing as well, completely in a new country. And that was really challenging. So that conversation with my boss was a tough one, but that's something that needed to happen. And at that time, he asked me to talk to our sponsor. And that conversation with my sponsor was quite scary because it could have gone different ways. But for me, I remember a picture that I was shown at when I was in the company. of a woman with a breast cancer who had gone through mastectomy. And then, it was a horrible picture. I couldn't remove that from my brain. Yeah. And that's what gave me the courage, like, okay, who's going to help? Are we doing anything right now? Are we helping this patient? Mm-hmm. And so I went to our sponsor and just have a very courageous conversation with him and not blaming anybody. This is just a huge change and people are afraid. And when they're afraid, people are just they're just human beings, mm-hmm. right? And I had a conversation with him, understanding what's your goal? Is this what we talked about? Is it still your objective? Mm-hmm. And, I am here. I'm still passionate and I want to help you. But, something needs to change. I need incentive. I need accountability for this to work. And he listened to me and didn't say anything. It was very quiet. So that was quite scary. So that's really the courage to go and talk to him. And I remember, when I finished talking to him, he asked me, what would you do? I was like, well, those are the things that I need. You decide how you want to make this change, right? But these are the things that needs to happen, and I need you to communicate. And he said, thank you very much. Asked me for my family. I went back. That was in Switzerland, this conversation. I went back to West Africa in Ivory Coast. And a couple of months later, he made the changes and brought somebody who was fully accountable for it, and that became my GM, and that's how I became the chief of staff of that person. And now everybody is integrating the project into the businesses of the different countries, and we all have the same objective. Now I have incentive, I have accountability, and we start working and making a difference and putting patient on treatment. Wow. So that was
that's an amazing experience because
a scary one.
Yeah, talking with a lot of leaders, we all talk about accountability, and that's nebulous because you can't have it unless you know what you're measuring against or setting goals and KPIs and things. And it's fascinating to me that you're doing it at such a level and scale that you're talking about a country, not a company. And that influence of global community, and how you led through that's an amazing thing. Yeah. If there was one takeaway or one piece of advice on, again, globally, what would you share with us?
Always challenge the status quo. And don't take no for an answer.
Yeah, I like that.
Good answer.
I like that a lot.
So you mentioned working with the GM. When you're building teams, when you're in charge of bringing someone onto the team, what skills are you looking for that are going to pave the way to success for the mission?
We are more and more into very complex, environment. It's becoming more and more complex, and things change all the time. So adaptability and flexibility are two things really I look into a leader. I also look for integrity. I look for somebody who's able to inspire others and servant leadership as well. Somebody who's able to collaborate, because in order to make things happen, we cannot do it alone. And is bringing different folks together and being able to inspire them and empowering them to actually get to an objective. So it's very important for someone to have what I call we live in a VUCA environment, and VUCA is the volatility, uncertainty, complexity, and ambiguity. We have all of that all the time in anywhere. We live it every single day. So now that flexibility and being adaptable to situation is a key skill I feel like every leader need to have. And being able to also bring people together and having the courage to, even when it's hard, when it's challenging. And so those are the things that I look for, especially like that servant leadership and you are there, and you're leading folks, you're leading people, they're all human beings. They want to do the best job they want to do. So it's for you to be able to listen, bring them together, and removing barriers for them, empowering them, and it's beautiful what they can deliver.
Absolutely. And what an incredible journey and career so far. Mm-hmm. Looking back, what advice would you have given your 20-year-old self?
The advice I will give my 20-year-old self. Well, this one is very interesting. The first advice I will say, set boundaries. Set boundaries for yourself and self-care. It's absolutely important because those are the things that allow you to be resilient when challenges happen. And challenges will happen in your journey. That's just part of it. So if you don't set boundaries and you don't take care of yourself, you won't be able to build that resilience. The other thing also, I keep coming back to servant leadership. It's something that I would embrace early on, right? And leading people with love. Being kind. I'm not saying be nice. Be kind, because it's different. It's very different.
How do you see the difference between nice and kind? I think that's, again, fairly subjective. Like, I have an answer. Mm-hmm. But what's your answer?
To me, being kind means I can be speaking to you. I want to give you feedback. But because I care about you, again, it's going back to leading with love. Because if I care about you, then I have some love for you because I want you to do better. I want you to improve. If I give you that feedback, that constructive feedback, I'm being kind to you. Yeah. I can decide and say, oh my gosh, I don't know how she's going to take it, so I'm just going to be nice. Then I'm not loving you. Yeah. I'm just being nice.
Powerfully stated. This is really a masterclass in leadership. Thank you. The last question that we ask our guests on each episode is what hiring for good means to you. We like that the title is subjective, and I'm so curious to hear your answer.
Hiring for good. To me, hiring for good is hiring an individual that can align with the mission of your organization, but also an individual who can enhance your culture in your organization, and someone who, by enhancing the culture and or strengthening that culture, aligning with the objective, then what we want to do to solve societal problem, that person will be able to help you solve those societal problems. So when I think about hiring for good, it's really like using hiring strategies and getting individuals in your organization to achieve the amazing thing that you want to do, in my case, for patients. That's how I think about hiring for good.
I love that.
I do too.
Because again, you're bringing it from the individual to the mission to the ultimate outcome. And you said that at the very start. The objective is the patient.
Yes.
And how does that flow transcends from one to the other? I love that. That is beautiful.
Yeah, thank you. For me, it's all about the patient. And in my journey, everything that I do, that's what I have in mind. And the patient needs somebody to help them, to advocate for them. And especially in underserved communities, we need to really bringing the people who have that passion and get to that objective.
Wow. Thank you. What a pleasure this has been. I just am grateful that you were able to come and share your wisdom with us and with our audience.
And we will share, again, your link, how people can get a hold of you. So what are you working on now?
Right now, I just started my own business, the Global Impact via consulting here in Portland. And what I'm trying to do is to help also life science companies here, bring my experience and then helping them, with strategy and driving growth so that at the end of the day, the patient can benefit from the beautiful innovation that they have.
Well, if you need to get a hold, you'll know where to get a hold of her.
Thank you so much.
Thank you. This has been an absolutely pleasure and an honor for me. So thank you so much.
Thanks for joining us today at Hiring for Good. If you were inspired by our conversation, don't forget to like, follow, and subscribe wherever you get your podcasts.
And if you want to learn more about our executive search services, check us out at www.hiringforgood.net or our company website, Acumen Executive Search.
Thanks so much, and don't forget to join us next time for another in-depth conversation about transformational leadership. Until then, have fun.